Did you guys see the recorded lectures for all the other parts? So I hope you guys saw that. Um, any questions before I start?
Before you start, this is Whitney. I am present. I'm driving and listening to the lecture over phone, so I can't type in present whenever at the end of your session.
That's fine, no problem.
Okay.
Um, yes, the beginning. What is the beginning? Oh yeah, the beginning of the respiratory. Okay. All right. So again, I'm gonna emphasize here that my thing might look a little bit different because I added some stuff. So don't worry, I will post it again. I will try to post it hopefully. Again, I'm also going to emphasize that pay attention to the stuff that I highlight. Okay. So the upper the structures of the upper respiratory system. As you guys know, the upper respiratory system includes all the way from the nose, nasal cavity, to the pharynx, okay? As we all know, the upper respiratory system is lined with tiny hairs and ciliated mucous membrane, whose function is to basically filter inspired air, okay? Filter inspired air. The sinuses carry fluids. The sinuses carry um, fluids, and infecting microorganisms can get into the nasal cavity from the sinuses, okay? And then the ducts from the eyes and auditory tubes, which is the Eustachian canal, from the ears can also carry microorganisms to the pharynx, okay? So this is basically, this is a way that person can get pharyngitis, okay? Lymphoid tissues called the tonsils or adenoids. They contain lymphoid cells that try to combat microorganisms in the nasal cavity, pharynx, and auditory tube, okay? So the mucus of the upper respiratory system contains antimicrobial chemicals. These are basically, by the way, what we're going over are different ways. These are defense mechanisms that the upper respiratory has in order to defend us against infections, okay? So the mucus of the upper respiratory system contains antimicrobial chemicals, including defensins, lactoferrin, and lysozymes to defend us against microbes. Now, the lower respiratory system anatomically it begins at the larynx, includes the trachea, the bronchi, the bronchioles, all the way to the lower um, respiratory tree, which is the alveoli. If you guys remember, the alveoli is the site of gas exchange. So these are the structures of the lower respiratory. This is important because whenever we talk about respiratory infections, doesn't matter if they're viral or bacterial, we always divide respiratory infections into upper respiratory infections and lower respiratory infections. So we use an anatomical classification to categorize respiratory infections, okay? As we all know, the lungs are surrounded by the pleura, which is the protective membrane. Below the lungs, we have the diaphragm. Then we have other contaminants. So we have other defense mechanisms, okay, of the cilia lining the trachea, bronchi, and the bronchioles. They carry mucus and the trapped contaminants. This is basically the ciliary escalator. Okay, this is a defense mechanism of the lower respiratory system, which is the ciliary escalator. This is basically what you cough up, okay? Other defenses are provided by alveolar. In the alveoli, there are macrophages. We call them alveolar macrophages, okay? Also, we have immunoglobulins, especially immunoglobulin A. This is found in tears, saliva, and respiratory mucus. So make sure that you know the defense mechanisms of the upper and the lower respiratory system, okay? Okay, so this part here you guys don't have. this is basically a summary of what I went over. It's a nice summary, so I put it in here for you guys. Okay. Any questions so far? No questions? All right. So, viral diseases of the upper respiratory system, of the upper. Obviously, the most common one is called the common cold. What is the definition of the common cold? How do we define common cold? This is an acute infection of the upper respiratory system caused most commonly caused by viruses. The most common virus that causes the common cold is the rhinovirus. You have to know this. The second most common cause is your guys' favorite one. It's in the same family as the coronavirus. Okay, these are the two most common causes, rhinovirus being the most common. And here I put a visual mnemonic for us to help to remember. This is a rhino with the common cold who's drinking a Corona beer. This will help us to remember the most common causes of the common cold. Okay. Now, the most common signs and symptoms of the common cold include runny nose, sneezing, nasal congestion, sometimes even cold, and a cough. Okay. Now, the cough in a virus, if it's due to a virus, the rule of the thumb is that the cough is going to be a dry cough, okay, as opposed to a bacterial respiratory infection, which causes a productive cough of yellowish green mucus, okay? Now, when symptoms are severe in a common cold, there may be over 100,000 virants in the nasal cavity, okay? Pathogenesis, okay? The cold viruses reproduce most effectively at about 33 degrees Celsius, which is the temperature of our nasal cavity. And that makes sense why they like to cause infections there, okay? So the lower respiratory tract, because it has a higher temperature and because it has a acidic pH, it tends to destroy the rhino and the coronavirus and does not allow them to cause infections there. This is a general rule. Okay. Any questions so far? Okay. So we just talked about the common cold. Okay, the common cold. Other infections of the upper respiratory tract. This one you guys don't have, okay? It's in the same document, but I just added it, okay? So we just talked about the common cold. The other one is pharyngitis. Pharyngitis is basically sore throat, and it can accompany common cold, okay? It's actually, pharyngitis is actually caused by excretion of chemical inflammation mediators, which stimulate pain nerve endings, okay? Common causes of pharyngitis is bacteria, also viruses like the enterovirus, Epstein-Barr virus, and cytomegalovirus. These are other common causes of pharyngitis. Croup